Okay, we're back. We're live. Here it is on a Friday. Time to relax and talk about science on Likeable Science. This is Ethan Allen's program, but he's indisposed today, so I'm stepping in for him. I'm Jay Fidell. And we have a Skype interview today with Sigal Ben-Ari, who is she's a multiple scientist in Seattle. We catch her by Skype in Seattle. Welcome to the show, Sigal.
Hello, thank you for inviting me to a show in Hawaii.
Well, it's the same thing by Skype, you know? The magic of technology. So
Yes.
Sigal is with the Cascade Behavioral Health Center, which is a hospital in Seattle. And we're calling this Science in Seattle, although by no means is it limited to science or Seattle. It's really about business, and it's global business, but it sort of begins with science in Seattle. So, I said that you had multiple scientific and academic background. One is in business, one is in neuroscience, and one is in biomedical. How can you live with yourself, Sigal, with those credentials?
I take it one day at a time, like all of us.
So tell us about the credentials. Why did you get credentialed that way? What was driving you?
Well, I'm very passionate about science and specifically about medical healthcare science. And I've wanted from a very young age to learn healthcare, biology, medicine, and at the same time, I was relatively good as an engineer and all the technical stuff. So I became a biomedical engineer, worked in a number of biomedical startups, and came to the US to do my PhD. I did my PhD in neuroscience, where I was utilizing those data analytics technical skills in neuroscience and collaborating with a number of labs around the world on integrating data from different levels of behavioral data, neuronal data in the brain. Had a really interesting PhD, was in a wonderful lab surrounded by fascinating, smart individuals. But what I realized was that as a scientist, you're working on one problem for a very long time. And it's, for my personality, I like to look at the global perspective. I like to look at how to get things done and to achieve and to accomplish marketable things that I could actually point and say, this is what this therapy is helping individuals in the market, in hospitals. I can identify that. So in order to do that, I realized that I need to transition into business. Went to Wharton. Wharton has the #1 healthcare business major in the world, and learned a great deal about healthcare innovation, how to get products into the market, and leverage all that insight that I had from my multiple degrees in my career afterwards.
Yeah, my brain is flooded with questions. So you're from Israel originally. What sort of training did you do in Israel?
So that's where I became an engineer.
Okay.
And in Israel, we have quite a share of engineers. We have a top-notch technical university called the Technion, with a number of Nobel laureates from there. So I think from an engineering point of view, I had really good education. I served in the military. It's compulsory in Israel as an engineer. And what's nice about this serving in the military as an engineer, that you get to experience many things that the 20-year-old would not experience, because everybody around you who's an engineer is 20-year-old. So you get to grow a lot through your career in the army, and afterwards went to medical device startup, where I leveraged those techniques that I learned the Technion, my university, and the army into medical devices.
Yeah, I want to take some time later on in the show to talk about the science ethic, the innovation ethic in Israel. So am I right to say that the business side of this came later in the continuum of your training? You went to Wharton
Yes.
for the business side, and that was after you realized that you needed, or you wanted to have additional training in business so you could take these startups to the next level.
Yes, I was in my kind of early 20s. I was a complete data geek. All I wanted to do was sit in front of my computer, analyze data, and I thought that through that I could make an impact. That just by looking at the data, you can find revelations and get the impact I wanted to do in the world. So
Now,
only later. Sorry.
We know that you're into a certain area of science, and we know that you're into helping startups and taking a global look at using your business and entrepreneurial knowledge to advance those startups. But I'd like to define some terms here. What is your primary interest in terms of the technology? Is it medical devices? Is that what we're talking about?
In terms of healthcare in general.
Healthcare in
so
general.
I've worked in a great deal of my career was focused on medical devices. But part of the challenge in everything, even to getting medical devices into the market, is the operations behind it. And that's why I transitioned into a hospital, where we actually don't do any medical devices here.
Mm-hmm.
But the operation and the care for patient is a key component to provide that. To provide therapy for patients.
So you're at the Cascade Behavioral Health Center, and you're the
Yes.
business development director there. Is it part of your job as the business development director to help these startups, or
No.
what's the relationship of your efforts to help startups and your work as business development director at the hospital?
My day job is business development director at Cascade Behavioral Health, where we are looking at Cascade and the bottle company of Acadia that owns us. We are looking at innovation to bring into the hospital. In addition to my job, I work as an external consultant to venture capital companies and to emerging startups, because I do have a lot of experience from working in startups and from working in my previous job at Medtronic with innovation, with with investment in those early on innovations. I can provide a bigger perspective to those entrepreneurs and to venture capitals about what would be successful in the market.
Yeah, it's sort of translational. You start
Yes.
out with very geeky scientific entrepreneurs who know more about science than anything in the world, and then you have to explain to them how the real world works and how to raise money. It requires
Yes.
a different side of your brain, I think. So who is your customary client? Somebody comes to you and he's a PhD in some area of science of healthcare, and he says to you, Sigal, I think I have a great idea. I think the world needs this. I want to advance it through a company. Can you help me? And I guess he would be your conventional client. Describe your client, your average client.
Well, usually I get my clients through venture capital firms who ask me to assess a technology, to assess a company, because they would like to invest in those startups. And I help the venture capital understand what is the pluses, the advantages of that company, and where are the areas of growth, and what needs to happen in order for it to succeed. By succeed, what venture capitalists usually care about is return on money. So they invest a certain amount of money in a startup, and they want to see that money grow tremendously in a few years. So they're looking for those kind of investments.
So now you're representing the VCs, or you're representing the startups?
I usually not right now represent the VCs, and then they send me to help their portfolio companies. Mm-hmm. So I work with the entrepreneurs on who had, let's say, a 5% share from the venture capital firm. But the entrepreneurs still need the support in order to get their product into the market. And it's not just about does the innovation work. It's also what are the regulatory requirements and who can help me with regulatory. And so I might refer them to a regulatory specialist who all they know is just regulatory. How do I get into the market? When I have a product, when I have CE mark, for example, CE mark is a regulatory approval in Europe. How do I get my product to be sold in hospitals and clinics if it's over the counter? It's those kind of pathways into the market is not intuitive, and you usually need to partner with larger companies that have distribution pathways and sales force to do that.
So what are the standards that, what are the parameters that work? In other words, what tests do you apply to see whether it's ready for capital, ready for marketing? What kind of a company do you want as a subject company? What kind of an entrepreneur do you want? What kind of science do you want? How do you measure them?
So in order to answer that, the answer has changed recently. Because, as we can see right now, and I'm focusing on healthcare, in healthcare, we're paying way too much as a country for healthcare. So in order to succeed as an entrepreneur in healthcare, you need to have some innovation, disruptive innovation, something that either replaces the current technology, a current medical device, a current pill that someone is taking, and makes the whole process either clinically better or cheaper. So if a product, the other kind of in healthcare, my two assessment, is it superior clinically to anything else that's out there in the market? Or does it do the same job or even better, more cheaply? If and the ideal is that it's going to uphold those two requirements. Mm-hmm. So that's in terms of the technology itself. But what is the population that the technology addresses? We need to look at the number of people that could benefit from this type of technology. Are they and how can we get to those individuals? Because are there already distribution ways that are established, or do we need to create a new distribution way? Because if you don't have enough people who will benefit from this technology, that means that the technology needs to be priced either high, or that you make it, or that it's very easy to get to those people in order to to get enough ongoing revenue once you start to sell the product.
Yeah, so this is a complicated intersection because you don't want to put money into a product that's not going to help enough people to warrant the investment in the development of that product. So at the end of the day, it's all economic. Yeah?
At the same time, the U.S. government recognizes that, and there are easier ways to get to market if the product only addresses a small population. It's called, for medical device, humanitarian device exemption. And it's just easier, cheaper, quicker to get to the market with a product that can help those small number of people, and it's up to 500 people a year. And that actually makes it worthwhile to get to those individuals. At the same time, those individuals have to be centralized with key physicians in order to learn about this new technology. If they're being seen by a regular family doctor, family doctor won't know about the most innovative drug out there. They won't know to refer them to them.
Yeah.
So is the market still ready for that?
Yeah. Well, it strikes me that if you see a lot of these, and I guess you do, you're not going to accept every single one that comes to you, I suppose, because some of them will meet the parameters and others will not. but you probably see a lot of possibilities in healthcare, a lot of technological advances. And so I wonder what your personal philosophy is about that. I mean, are you in this game for the science, the thrill of the science? Are you in this game for the thrill of making the money? Or are you in this game for mitzvah? To raise the...
I'm definitely for mitzvah. I'm definitely here. I want to make an impact. I want to advance healthcare and to provide a more superior care for patients and people in need, and cheaper.
Yeah. So where is it all going? We've seen. I know Obamacare is still controversial to some extent, but and probably will be for a while, just politically. But where do you see healthcare going with this new science? It seems to me every time you hear about some advance in healthcare or devices, especially devices, you think, wow, it's great to live in these times, because in these times we can have the bionic person. We can have extraordinary things that will save our lives and extend our lives as never even conceived 10 years ago. Where do you see it all going?
We are living in extraordinary lives. Think about healthcare 100 years ago, and diseases that used to kill people versus now, and the life expectancy has increases, infant mortality decreased. We are living in wonderful time. At the same time, it can be improved. Now, potentially the low-hanging fruits have already been picked. Potentially it's harder, and you need to invest more in to get something revolutionary into the market. But what we see now in healthcare, that this is the era of IT, electronic medical records, and the utilization of computers in data mining of big data sets of electronic medical records in order to understand what actually helps people. Because unless you inquiry 50,000 people, 250,000 people, you might not know what are best practices. And now we can leverage those type of analytics and IT methods to improve our healthcare.
Yeah, that's very exciting, because when you open any scientific field to computers, the computers can take it further than you ever imagined. And we interview a lot of young scientists here from the University of Hawaii, and big data is always involved.
Right.
And more you realize that it is the center of what they do. Let me take a short break here, Sigal. We'll come back in a minute, and I'd like to ask you at that time if you can give us a couple of examples of companies that you have worked with that have succeeded. A couple of winners I'd be interested in sort of getting an anonymous profile, or maybe if you like to name them, and see how far they went with your help. That's Sigal Ben-Ari. She is with Cascade Behavioral Health Center. We're here on Likeable Science, which is Ethan Allen's regular Friday program from 1 to 2. And we're talking about science in Seattle, which is not limited either to science or Seattle. We'll be right back.
Aloha, my name is Josh Green. I host a show called Healthcare in Hawaii here on ThinkTech. We get together once a week, or sometimes twice a month. Depends. When we're busy, we get together less often, but we love to see you here to talk about the preeminent healthcare issues in our state. Our programs vary very widely. We talk about economics, we talk about healthcare, we talk about social issues on this program. Thanks for joining us.
Aloha, I'm Hunter Hevelin, host of Sustainable Hawaii here at ThinkTech Hawaii. You can tune in every week on Thursday at 2 p.m. to see interviews with sustainability professionals from around the state and even further abroad, learning about activities with water management, food security, waste management, and a whole host of other fascinating opportunities to get engaged with making a greener island. So if you're interested in making the transition from consuming individuals to communities of producers, check us out every Thursday. Aloha.
Okay.
Yeah, we're good. We're back. We're live. I'm Jay Fidell here on Likeable Science, standing in for Ethan Allen. And we have the pleasure of talking to Dr. Sigal Ben-Ari. That's an Israeli name. She's with Cascade Regional Health Center in Seattle. And we're talking about science in Seattle, but that's not limited to either science or Seattle. You'll see what I mean. So coming back to our earlier discussion, Sigal, just going to get a handle on some examples of winners that you've handled. What were the parameters? What was the kind of device or science that was involved? How did you help them, and where did they go from there?
Sure, of course. And you have a few examples that I've provided. So would you like to lead me through whichever example?
You sent us some photographs. Let's put some photographs on the screen, and then we'll have a. Okay, this looks like this is a bacterial pacemaker we have on the screen.
Sorry, what is it?
It's a bacterial pacemaker. Does that sound right?
So that's actually
antibacterial pacemaker. What is that?
It's an envelope that it's an antibacterial envelope that you put the pacemaker into the envelope, and what that envelope does, it dissolves in the body and reduces the likelihood that after an implant of a pacemaker there's going to be an infection. And infections are a very bad thing. It hardly happens. Mm-hmm. It's very rare. But when in the few instances that it does happen, it's not a good ordeal for the patient, it's not a good ordeal for the hospital that needs to take care of it, and on top of that, it's very expensive for everybody. Mm-hmm. So this is a kind of innovation that, as I was talking earlier today, it exemplifies the type of innovation that we see going in the future, where it increases the quality of care because it reduces the likelihood of having an infection after implantation of a device, but it also reduces the overall healthcare costs. And there are different business models in order to sell this kind of technology. One of those business models that potentially, I don't know if could be used in this kind of envelope is risk-sharing model, where the company who sells this technology together with the hospital share the risk of having an infection and the cost associated with that. And it's a win-win for everybody, because if the company, by this, the company is actually Medtronic, mm-hmm. If the company, they believe in this product, they're willing to take the risk that indeed infections will go down. They're also willing to take the financial risk, and the entire system benefits from it.
I wanted to shout out on Medtronic. Medtronic has a significant presence in Hawaii. Earl Bakken, I guess he's the founder of Medtronic, lives in Kamuela and has done many philanthropic things up there. And we have Alan Zecca, who lives here in Honolulu, and he opened the Asia division in Japan of Medtronic. So we have plenty of Medtronic around town. And in fact, ThinkTech has interviewed Alan Zecca on a number of occasions. Anyway, so how did it all work out on a business basis?
It's still going on. They are doing a very large randomized clinical trial to prove the value of the technology. I'm a believer. I think it's going to work, and I think that with a very smart, innovative way to market this product, it's going to be very successful, and we're going to see it in hospitals across the world.
Is that risk-sharing idea? That's new. That's the marketing innovation you're talking about.
Yes, it's a new concept. It's not just about selling a product to the hospital and the hospital paying and taking the risk that the product will work for himself, or the insurance company will pay and takes the risk. Now medical device companies who believe that their product will work and will provide those cost benefits are willing to risk their financial survival on on a risk-sharing model, saying that we'll take the burden of the financial hit if something goes wrong.
Well, so
And
the question comes as to exactly what the metrics are. I mean, how do you know what the dollars and cents are if if the worst case analysis takes place? Can you put that in dollars?
each hospital records how much they spent on cases that for this instance that went kind of bad, and there was an infection, and the device has to be extracted and replaced with another device. That information is known. The percentage of that happens is also known, and we're going back to our previous discussion on health analytics and electronic medical records, and the ability to query and look in historic data. And that's a benefit of our own age. Now we can do this kind of analytics, and thanks to that, also the risk-sharing models.
Yeah, so that's very interesting. So this new model that you've invented, which makes it possible to market this device, is really a function of other technologies that didn't exist a few years ago.
It is, only I didn't invent it. It's been thought of by other very smart individuals.
Okay. Sorry, I wanted to give you credit for it anyway, Sigal.
Thank you.
So let's talk about the cardiac monitoring device. We have a photo of that too, which we'll show now. And that was another one of the deals that you worked on. Tell us about this one.
Okay, this is that's actually was developed internally at Medtronic again. It's remarkable. When you're thinking about cardiac monitoring and identifying is an individual that faints or experiences weakness, is that related to a cardiac event? And there are kind of older generation monitoring devices. They can last until a week, a month, and can monitor a person. But what happens if if fainting happens once every other month or once in a year? How do you know if that was caused by a cardiac event? And fainting is very dangerous. Like if you're fainting while you're driving, I don't want to even talk about the ramifications of what could happen.
Sure.
So it's important to identify what is the root cause, so the treatment will be according to the precise cause, the precise medical cause. And that tiny device is injected into the body and continues to monitor the EKG, the cardiac output, the cardiac signal, for up to I think at 3 years. So for 3 years, it can monitor the EKG, see if there's any arrhythmia, see if there are any issues with the heart, and remotely send that information to a physician doctor who identifies those arrhythmias.
So what about this is with radio, and there's a radio receiver nearby?
So the way it works, when a patient goes to bed, there's telemetry that goes into an external device, and that sends it out to the physician's office.
Oh, so actually the patient doesn't have to do anything but put the telemetric device on his chest, that's all.
Yeah, nothing like that.
Okay, so when he goes to sleep, for example, he attaches some device right on his skin, I take it.
No need. It just goes to sleep on his bed. The device that sends the information is right next to his bed. It's really user-friendly.
Yeah, that's great. Now so what's the level of development? What's the level of introduction to the healthcare community?
Right now, this tiny device that you see was just launched. I believe it was launched a year ago. Extreme success. It was considered a very successful launch with implementation in the U.S. Patients who are experiencing those kind of fainting or arrhythmias can reach out to their physician to ask about it.
Amazing, amazing. Okay, let's go to another one. We have one more picture coming up. This is a picture of Zuri, what is the name of the picture? This is the Brain Stimulator. Sigal, what is that?
My favorite of all.
Okay.
This is a product that's been around since the 90s. It's kind of a twist on pacemakers. It's a pacemaker where the electrical stimulation is actually being provided to the brain. And it's being used to help symptoms of Parkinson, essential tremor, dystonia, OCD even, in the US and outside of the US, in Europe, epilepsy. And our focus, the biggest market right now is in Parkinson and essential tremor. And it does miracles for the symptoms of those patients. It's magic. And when
it's a real blessing. I mean, somebody with Parkinson's quality of life deteriorates terribly, and with this,
yes.
the quality of life can be preserved, and you can lead a reasonable life. Yeah.
Yes.
Well,
and for dystonia, it's one of those diseases that are horrible. Kids may get that. It's a very small population that can be impacted by it, but those kids end up in wheelchairs. It's really horrific, and it's under humanitarian device exemptions. It's limited in the number of implants you can do in the U.S. But again, I've known a number of dystonia patients who run marathons after being implanted with that device.
Is this also Medtronic? Is this device also Medtronic?
Yes, this is the device.
Yeah.
This is the device that's been invented and manufactured and sold by Medtronic.
Yeah. Well, you know what's interesting is, a few years ago, I mean, at the inception, Medtronic was dealing mostly in heart devices, I guess. And now look, we have learned more about the brain. We have learned more about how to read the brain and affect what the brain does. It's quite remarkable, all in our generation. And we can do extraordinary things with the brain. And here Medtronic is finding ways to make devices that, it is, as I mentioned before the show, I mean, who knows where this ends. We can do much more than just medicine using, invasive devices in the brain.
Yes, and there are ongoing research topics on how to use that for Alzheimer even.
Yes.
It's still in research, but brain-computer interface, very hard field in science.
Yeah. Let's take another break, Sigal. That's Sigal Ben-Ari. She's with Cascade Behavioral Center in Seattle. We're calling this show Science in Seattle, but that's a limited description of the show. We're talking about much more than science and much more than Seattle here on Likeable Science. We'll be right back after this short break.
Aloha, I'm Hunter Hevlin, host of Sustainable Hawaii here at ThinkTech Hawaii. You can tune in every week on Thursday at 2 p.m. to see interviews with sustainability professionals from around the state and even further abroad, learning about activities with water management, food security, waste management, and a whole host of other fascinating opportunities to get engaged with making a greener island. So if you're interested in making the transition from consuming individuals to communities of producers, check us out every Thursday.
Okay, we're back. We're live with Sigal Ben-Ari, who is the Business Development Director at a hospital called Cascade Regional Health Center. But she's more than that, because she has another role entirely in helping healthcare devices and healthcare entrepreneurs reach the market. And one of the problems, of course, as with any entrepreneurial enterprise in this country, in the world for that matter, is getting capital, getting sufficient capital quick enough at the right time in the cycle, so that you can build a technological tech company and succeed. So that's a lot of what you do, and I just wonder where we are these days in the venture capital continuum, are we getting enough venture capital into these companies? And
Not
if not,
at
what
all.
can we do about it?
No, we're not getting enough venture capital money into those companies, and it's even starting before. There's before venture capitals get involved. There's angel investors. So there's a family, friends, and then some early high risk tolerance angel companies that invest. And the amount of capital that's being invested in healthcare, and this is kind of my thing, healthcare, is tremendously lower than what it was in 2008, just before the recession. And the entrepreneurship market has just not recovered yet from that recession. So it's harder to get angel money. Those angels now provide support to startup later in the development process, and venture capitals get involved when startups de-risk their products to even more and more. And by de-risking, I mean there's already proven of concept, there's safety, and even sometimes efficacy before venture capital firm gets involved in this startup.
Well, so what's going to solve this problem, and how do you solve this problem when people come to you and they want to make deals and capital needs to be found? What do you do? What's creative? Can you tell us your secret about that, Sigal?
Well, if I'm talking to entrepreneurs, I'm trying to provide guidance into earlier on being very careful about where entrepreneurs spend their time. Which product are they providing, and realizing that in entrepreneurship life cycles, the product may change and the market target will change, but really being focused on the earlier you get focused on a product that can be actually marketable, have a large market cap opportunity for growth, and relatively less expensive to get to the market, the better those companies are. And it's very competitive, but there are still winners. And there are still companies who get those ventures and then down the road either being bought by larger corporations and are invested to them to get into the market, or do an IPO, go into the stock exchange.
So if I'm a young entrepreneur and I'm into, say, healthcare technology, are there people like you all over the country? How do I get connected to somebody who can advise me?
That's a good question. Well, you can reach out to me.
Okay.
Additionally, I would actually develop a relationship with venture capitalists. And venture capitalists and even angel investors and people in the whole entrepreneurship landscape would provide even free advice on on their thoughts on your product. What do they think is the pathway in the future? And they want to build up that relationship so that when you de-risk that product, that venture capitalist will have the relationship to invest in you.
This is where your training, your science training, your business training come into play, where you can advise somebody where the real product is and where the real market is and put them together. I think the average scientist doesn't know.
Exactly, and the average businessman doesn't understand the intricacy that's involved in the scientific aspect of the innovation.
Yeah. The last question I want to deal with here in the remaining few minutes of our discussion, Sigal, is one that I always think about. I always think about Israel. I'm a complete Zionist. Sorry. And here you are. You're half a world away. Who would have thought, say, 15 or 20 years ago, that you'd be here doing this in Seattle? I don't know if you thought about that as a career path, whether it just happened by accident. But what you bring with you, for sure, is the special Israeli sense of innovation. And I'd like to explore that with you. By the way, do you agree with me that there is a special Israeli sense of innovation? And if you do, how do I get it? Is there a pill? Can I take a pill? What do I need to do?
I think what makes Israel unique is there's an entity over there that people who are fascinated about technology, engineering, science, biology, healthcare, and you're working if you're in a university, if you're in startup, you're with like-minded people. And when you're surrounded by like-minded people, that supports innovation, that supports more free-flowing thoughts about where to move your product next. That's one thing. The second thing that helps Israelis are a willingness to take risk. Entrepreneurship is hard. The likelihood of failure is very high. And Israelis are not intimidated by failure, not because they're not failing, they are failing. But once you fail, you learn from your mistake, you learn what went well, what didn't go well, and then continue and move on until to the next innovation. And that's key. Kind of the tolerance for risk is key for entrepreneurship.
Yeah, well, I mean, there really have been some extraordinary examples of that. I was telling you that only this week I learned about the car that an Israeli company, only a few people, maybe less than a dozen people are involved in this company. Yeah. But they have engineered a car that runs on aluminum, which they say includes the energy that it took to make the aluminum, and they release the aluminum with a combination of water, drinking water, and ambient air, and they had this car. You can look it up on the web. The name of the company is Phinergy, P-H-I-N-E-R-G-Y, and they have this car going hundreds of kilometers, and all you have to do is pour in drinking water. Amazing.
Amazing. Yeah, it's amazing. So, and there are examples like that, like Given Imaging, that took a product actually from the military, from this defense technology, and transitioned that into a tiny camera. It's a pill. That inside the pill there's a camera, and you swallow it, and that does that visualize your entire digestive tract and intestine.
And with a complete record of everything that it saw. Amazing, yes. Amazing.
It is amazing.
Well, I hope we can talk with you again, Sigal, and I feel we've only scratched the surface. You sent us other photos we haven't looked at. Maybe we can sort of resume this conversation with Ethan Allen in a few weeks, just to cover the things that I couldn't. And of course, when you're here, we'd love to have you come to the studio and check out our technology. It may not be healthcare, but it's technology.
I would love that. Thank you very much for inviting me to your show.
Thank you, Sigal. Sigal Ben-Ari from Cascade Behavioral Health Center in Seattle, here on Likeable Science, and I'm Jay Fidell standing in for Ethan Allen. As they say, aloha and shalom.
Shalom, aloha.